Hello friends, welcome back in the channel of Clinical Care Insight. We've seen so many chapters in microbiology, okay? And now in today's class, we are starting a new lecture series on how we can control the microorganism. And the name of the chapter is Sterilization and Disinfection. These are basically the two methods to achieve the total sterility, you can say discarding the microorganism. In this chapter, we will discuss a lot about how to, you can say, preserve the foods, how to prevent the infection, the transmission of basically infection, how to break this chain of infection, fine. And we will also see that how these microorganisms, they resist the traditional method of, you can say, control of microorganism. So this is today's lecture outline. First we will deal with the introduction, then we will discuss about the principles, principles behind this sterilization and disinfection. Then we will see about the various methods, This sterilization and disinfections are the central, we can say, discussion point of our lecture, but we will see other means by which microorganism can be discarded or you can say eliminated. Then we will see about the kinetics of cell death. Remember that whenever you apply these, you can say the process, this method, and they are not suddenly microorganisms will eliminated, you can say instantly, they take time and they follow the pattern basically. So that patterns we will understood in the topic of kinetics of cell death, And at last we will discuss about the CSSID, It is basically a specialized area in the hospital setting or you can say the healthcare setting where most of the, you can say the soil or you can say the infected medical devices will be corrected, will be, you can say again, make to use. And it stands for the Central Sterile Service Department, Central Sterile Service Department. Now, the question is why we have to control the microorganism? Why we have to control the microorganism? Remember, we are controlling those microorganisms which are considered as a pathogenic, which can cause a disease, Or you can say in another term, those pathogens which are easy to transfer from one person to the another person. Probably you heard about the diseases, the category of infections called as the cross infection from patient to patient, from patients to the health staff workers, isn't it? This is called as the cross infection. Then there are other infections called as eratogenic infection, which is induced by a doctor to the patient, isn't it? It's called the eratogenic infections. Then there are other you can say the type of infections, And for preventing these infections, we need to sterilize the equipments, we need to sterilize the environment, So this is our topic of discussion, This is our topic of discussion. So make the heading first about the introduction. Now, if we talk about the goal, why we are controlling the microorganism, the main aim of controlling the microorganism, the main aim of controlling the microorganism is to prevent the infections, prevent the infection. Now, these infections can be, as I said, it can be the cross infection, it can be cross infection, it can be eratogenic infection, or it can be called as HAI, healthcare associated infection, HAI, healthcare associated infections. Mainly in the developed country, it's seen that these healthcare associated infections, they causes they causes the, you can say, one of the largest morbidity as well as the mortality. Morbidity means, you can say, it is the rate, okay, which shows that how much you can say persons are ill, infected, and this mortality shows the death rate. Fine. Morbidity shows the diseased condition. It's referred as the disease condition rate, basically, okay, whereas the mortality means death rate. It's a death rate. So the main aim, remember, main aim to control the microorganism is to prevent the infection. Okay, is to prevent the infection. It can be the cross infection, it can be the erythogenic infection, it can be the HAI, healthcare associated infection, and also called as the nosocomial infection. Write it down. You came across these words in the textbook. That is called as the nosocomial infection. Okay, nosocomial infection. So whenever you visit those areas where there is a, you can say, high prevalence of the infections, you should protect yourself by means of masking. Okay, by means of, you can say, the hand wash. This hand wash and the masking, they are the some of the means of, you can say, protect a person. Okay, protect a person, and that is also comes under this sterilization and disinfection, or you can say this is come under the controlling of microorganism. So for control of the microorganism, there are various means. Okay, there are various means, but one of the, you can say, means is the sterilization and disinfection. Apart from these main aim, there are certain other aims. You know that if you prepare the food, okay, and if you leave that food for a longer period of time, it got, you can say, affected by the surrounding microorganism, isn't it? It's got affected by the surrounding microorganism. So there are many microbiologists who, you can say, prepare the devices by which you can prevent the spoiling of food. So the second aim of eradication of microorganism is the prevent the spoilage of food. Now, you know that whenever you obtained a product from the ruminant animals, like the cows, buffalo, take the example milk, okay, and if these cows and buffalo, they are infected by some of the, you can say, bacterial disease. If we talked about the traditional disease, that's tuberculosis. Okay, so tuberculosis bacteria, Microbacterium tuberculosis bacteria can be present in the milk. So we have to sterilize the milk. We can say we have to control the microorganism which is present in the food, isn't it? So this controlling of the milk product. Okay, this controlling of the milk product is one of the, you can say, broad aim of controlling the microorganism. Okay, and that is, you can say, dealt in the called as the method called as the pasteurization, which we will see after a few minutes. So one of the aim is to, you can say, make products. Which products? Yeah, animal obtained products. So make animal obtained food for longer use. Isn't it? No problem. Now, once we discuss that what is the aim, why we are controlling the microorganism. So remember, we are controlling the microorganism. The main aim is to prevent the infection, and these infections can be the cross infection, it can be the erythogenic infection, it can be the healthcare associated infection, it can be the nosocomial infection. No problem? Fine. Now, so you can say protecting now the question is arises, okay, now we understood the goal, the aim, why we are controlling the microorganism, fine. But how to control it? Okay, how to achieve the total, you can say, sterile condition, microbial free ambiscence. Microbial free ambiscence means there is no microorganism present, okay, in the, you can say, desired food, or you can say the desired parts, or you can say the desired surrounding, isn't it? So this is achieved by the, you can say, various means, and this all, you can say, achieving those microbial free ambiscence, we have to adopt something called as asepsis, aseptic techniques. Aseptic technique, or you can say asepsis, is the state of being free from microorganism. Okay, it's a free from microorganism. So we have to adopt certain aseptic techniques, or you can say the asepsis. Fine, no problem. Now, once we understood that this goal, what is the goal behind controlling the microorganism, okay, and why we are controlling the microorganism, okay, and what techniques we have to maintain. We have to maintain the aseptic technique, okay, we have to maintain the aseptic technique. And you know that aseptic technique can be, you can say, achieved by the various means, okay, by the various means. The one of the means is called as PPE, personal protective equipments. If you wear the glass while you are working on the clinical, while we are working on the clinical settings, okay, if you wear the you can say the glasses, if you protect your hand with the gloves, okay, gloves, and if you wear the gowns, these are some of the means. And the hand washing, okay, and the hand washing. You know, there are two pioneer microbiologists. There are two pioneer microbiologists who shows, okay, which shows that the diseases could be spread. Diseases could be spread by the hand contamination and the fecal oral route transmission. Fine. And if you want to know the name is Semnivis and the Snow. These are the two pioneer microbiologists who shows that this hand contamination as well as the fecal oral route is the ways via which the microorganisms can spread in the healthcare setting, isn't it? So for that, there are various aseptic techniques is developed. Now, for our lectures, we have to deal with the two techniques to achieve this aseptic condition, to achieve the asepsis. The one technique is called as the sterilization, and another technique is called as the disinfection, isn't it? Now, sterilization means total, you can say, sterility, or you can say total microbial free ambiscence. There is no any microorganism, fine. But whereas in the case of disinfection, there is, you can say, diminish the growth of microorganisms, but there is no total free microbial ambiscence. There is no total free from the microorganism. Microorganisms are there, but they are in their non-pathogenic number. Got the point? They are in their non-pathogenic number. Means their number are not significant to cause a disease, or you can say to infect the another person. Fine. But whereas in the case of sterilization, it is a total eradication, or you can say the total free from microorganism. Fine. So now make the heading sterilization, and in the next lecture we will discuss about the disinfection.
She doesn't think that.